Good afternoon, everybody. I'm Hazel Cheeseman. I am the Deputy Chief Executive at Action on Smoking and Health. Welcome to this webinar on Stoptober resources. And we've got some great people here today to talk about how they've been creating local and regional campaigns. Thank you for the agenda. So I'm going to make some opening remarks, and then we will hear from Alex Trewhitt from OHID, who will talk us through the Stoptober resources. Then over to Katie from the Humber and North Yorkshire Centre for Tobacco Excellence on maximising the Stoptober month and the approach that they're taking over in Yorkshire. Then we will hear from Tracy from the London Tobacco Alliance programme. And then last but by no means least, Lloyd from Fresh in the North East on their Smoking Survivors campaign. And then we should have 10 minutes for a Q&A at the end, assuming that I am an efficient chair. So if we just move on to the next slide, a bit of housekeeping. If everybody can keep themselves muted unless they're talking, and we will deploy the mute button at will for those who don't manage to mute themselves. Please submit questions, reflections in the chat, put questions into the Q&A. These things are always better when we have a lively contribution from all of you. We're recording it. We will almost certainly make the recording available. I can't believe that we wouldn't if we're recording it. And so if you've got any issues, drop us a line on that Smoke Free Action admin email address. A couple more slides before we hear from the more interesting people. What's on the next slide? Yeah, so where are we with the smoke-free generation? So I'm sure that most of you will know that we had a bill, the Tobacco and Vapes Bill, which was before Parliament prior to the general election. Which had cross-party support, made it through to the end of committee stage, but unfortunately hadn't quite got far enough through the process in order to be passed in the last Parliament. But both Labour and Conservatives committed to bringing that bill back. So we expect that to return soon. It would increase the age of sale for being sold tobacco, that should say, by 1 year every year. And it would give the government powers to tackle youth vaping, particularly in relation to how products are promoted and the way that they're packaged, etc. I'm sure none of you could have avoided the fact that possible additions to the bill when it comes back were leaked to the Sun. I think 2 weeks ago now. And that was particularly around extending smoke-free legislation to outdoor places. So, we shall have to wait and see when the bill is tabled. So the Minister was in the House of Lords last week saying that the bill will be back soon. So fingers crossed, we will see it back soon in this autumn. And it's plausible that with Parliament recessing soon but coming back in early October from party conferences, that we could see the bill being tabled during Stoptober. So what's on my next slide? So how I think, obviously, colleagues working for the Department of Health can possibly comment, but from an ASH point of view, the Tobacco and Vapes Bill coinciding with Stoptober, it's a really great opportunity to have a really positive debate with our communities about the harms from tobacco. There's been really significant media interest in all aspects of the bill to date, and that's very likely to continue. There is a really important argument to be made about why we need a phased out sale of tobacco to the next generation, why we might be looking at extending smoke-free legislation to more widely because of the unique harms from this product. And because it is uniquely harmful, that is why we put so much energy into trying to encourage people to stop smoking. So bringing those debates together throughout Stoptober is a great opportunity, I think, both to amplify the messages of the bill and also to amplify the message around why you should quit during Stoptober. So there'll be more ideas, I think, coming out of our case studies today, but, thinking about where the opportunities are to engage local media and local politicians, case studies with the clinicians that you have locally. I'm sure that many of you are familiar with the data that we have that's localised, the the Ready Reckoner, which you can break down to local authority level, to ICB level, to combined authority level, communicate the economic consequences of smoking, and the public polling data that we also have, which is regional. So lots of opportunity to use that to engage local media and have those conversations. And of course, when the bill comes back, great to have people writing to their MPs saying why it is that you think it's so important, asking them to back it. And if you're running a service or if you're doing anything else locally, which you think the local MP would be interested in coming along to visit, be a great opportunity. The month of Stoptober is a good time to do that, to get people along and show them what you're doing and why it is that we need this legislation. Okay, I think that's probably enough from me. Let's hear from Alex, who's going to tell us a little more about what the resources are for this year's Stoptober. Over to you, Alex.
Thanks very much, Hazel, and good afternoon, everybody. It's great to be here. My name's Alex, and I work in the Behavioural Programmes Unit here at the Department of Health and Social Care. So I'm going to go through a bit of an overview of what Stoptober is, where it's come from, what to expect this year. Just before I go into that, I just want to say a big thank you to Hazel and the team at ASH for organising this webinar, colleagues that are presenting alongside me today, but most importantly to all of you, over 300 people now on the line. So really great that everyone's sort of enthusiastic and eager to support Stoptober this year. So just to go on to a little bit about a bit of background in case you may be new to Stoptober, it's actually one of our longest standing campaigns, which we actually first launched all the way back in 2012. And it's really about, encouraging and supporting smokers to make a quit attempt. And we know from our evaluation over the years that we've helped over 2.5 million smokers to do precisely that. So it takes place throughout the month of October, and it encourages the smoker to sort of quit for a 28-day period of time. And that's really based on academic evidence that if they can quit for that time, that 28 days, they're up to 5 times more likely to quit for good. So that's really the premise that Stoptober has been built upon. We know that up to 70% of smokers do actually want to quit smoking. And we know that Stoptober, alongside other calendar moments during the year, such as New Year with sort of New Year's resolutions, No Smoking Day in March, it's really a great time to give it another go. Because equally, we know that quitting smoking can take a number of attempts and several attempts, possibly even up to 30 attempts before you manage to quit successfully. So every time is great in sort of making progress and hopefully quitting for good. And we know that from Stoptober, that sense of mass participation, so knowing that other people like me, other smokers, are sort of making it through the same experience as well. Stoptober historically always takes a what we call a hope-led approach rather than harms. So opposite to sort of some of the more sort of visceral kind of imagery that we've used in campaigns before around, the health harms of smoking, Stoptober's firmly positioned on that hope, kind of confidence building, doing it together side of the creative. So when we have national paid for activity, and it is quite different this year, as I'll go on to in the next slide, but we typically encourage partners such as yourselves to start kind of rallying smokers up to the sort of October quit moment as early as possible, but by certainly no later than the 20th of September to help them plan and make that quit attempt from the first. And as well as the usual kind of paid for advertising that we typically do for Stoptober, we know that we've got really great partnership support for this. So across local authorities, quit smoking providers, the NHS, charity, and employers. So once again this year, we're really grateful for that support you can give. Can we move on to the next slide, please? Thank you. So, as I said, Stoptober is quite different this year because there is no paid media activity such as TV and radio, which we have run in previous years. The main reason for that is not because we didn't want to put budget into Stoptober. We know it's still an effective campaign, but because the way the general election was called at quite short notice, we've had to go back through our planning to get a sort of budgetary approvals for that. So, sadly, in terms of meeting media booking deadlines and things, we were unable to do that. But we do know, as I've said, that there's really great appetite from the system and partners to do local activity around Stoptober. So we have managed to get a small amount of budget to create what we usually do in terms of a sort of a partner toolkit and resources to help you activate the campaign locally. So where I've said there, you're taking a sort of what we're calling a partner-led approach. What I would say is, whilst we're providing this kind of overarching toolkit and resources, the real opportunity here is to just use it as air cover and an opportunity to promote local services and local support. and undertake sort of, it doesn't need to be paid for activity by any means. I don't expect it would be because I know budgets are extremely tight. But anything you can do with your comms teams, for example, to do sort of things for your websites, for your social media, case studies, videos, and blogs would be really, really effective. I'm going to talk to you in a slide or two about the kind of Better Health quit smoking support that we offer nationally on the particular sort of digital on the Better Health quit smoking website. But like I said, it's a real great opportunity to, whilst you can promote that, also promote your local services and try and get people into those. Next slide, please. So what can you do? Like I said, we've seen really good examples over the years. We actually got the toolkit live up on our campaign resource centre a couple of weeks ago, and we've already had 6,500 downloads of resources, which is really, really encouraging. We're already seeing through sort of social feeds and things, people using the assets, but also really, encouragingly creating their own content as well. So some examples of things that you could do if you've not quite started anything and you want to do that locally. Things like scheduling content for newsletters, websites, and intranets, planning social media content and takeovers. And I think the one thing I would say the best approach to take here is to think September as a kind of rallying phase to get smokers to, one, raise awareness that Stoptober is coming, but also get them ready to start planning their quit attempt, because we know that a lot of quit attempts are unplanned. There's a tendency to go cold turkey and maybe not use any kind of support, which we know are the least effective ways to quit. So use that September time to rally them, signpost the support, and then from the 1st of October, move into what we call more of a support kind of phase with your communication to really keep them on track, sharing case studies, sort of tips and things about managing cravings, for example, what to do if you're starting to wobble, all that kind of stuff can kind of keep that momentum going throughout October. We've also seen some really great examples of displays, and a lot of you on the call, I expect to have maybe from pharmacies or GP practices or hospitals even, creating customer displays in those areas would be a really effective. If you want to go a step further, we've again seen some areas doing sort of more community outreach events out in the local community. And the final thing, which I think is really, really important, obviously most of that activity is targeting the smoker themselves, is actually raising awareness of Stoptober and the role that healthcare professionals can play in terms of sort of face-to-face consultation and again, offering support in that sense. Next slide, please. So just a really quick slide. This is quite high level, but again, I just thought it's really, really useful to include. And I know colleagues are going to go through some of this in a bit more detail in other sections of the presentation. But I just thought it was worth picking out sort of the 5 main kind of pieces of insight that we've got that may help inform some local activity. So like I said on the slide previous, most smokers know and want to quit, up to 70%. But one of the big barriers is around confidence. They don't feel like they can crack it. And that may be because they've failed before or maybe not even tried before because they just think they're going to fail. So anything that you can do around sort of boosting confidence. And again, that's where sharing real stories of smokers who have managed to quit successfully can be really powerful. We know that many smokers can justify continuing to smoke because of the perceived benefits of continuing versus the costs of quitting. So again, we know from recent insights that a lot of smokers feel like life is too stressful. Quitting smoking now will just have a massive impact negatively on my mental health. When actually we know that in the medium term, actually quitting smoking can have real benefits for mental health. So it's really important, and this is contained within the toolkit and key messages around emphasising what those benefits are for health, but also things like financial cost as well. We know that financial savings is a real driver for people wishing to quit. So anything you can do in terms of promoting those messages would be really, really good. There's often little or no research or planning going into that quit attempt. As I've said, up to 70% are unplanned. So that's why it's so important to signpost and make people aware of the breadth of support. It'd be great if people can access local stop smoking services because we know that they're the most effective way to quit. But it's understanding that everybody's different. Some people may wish to use an app, for example, rather than face-to-face support. So just promoting that is really important. One thing I did find really interesting in some recent insight was that we found that when clinicians don't mention smoking in a face-to-face situation with a patient, the smoker may conclude that it's not problematic, or the clinician maybe doesn't think they can change their behaviour. So again, I think there's a real opportunity with Stoptober to really try and encourage every kind of face-to-face interaction to raise the issue and talk about it, and again signpost to support. And it's really common that smokers perceive successful quitters as being very different to themselves. So again, this brings in that idea of case studies and using people like me to show, if they can do this, you can absolutely do it as well. Next slide, please. So just briefly to talk through, like I said, on a national level, this is all the kind of quit smoking support that we have on offer. So Better Health is our parent brand that straddles many different behaviours, from losing weight, improving nutrition, mental health, early years, and obviously quit smoking as well. So particularly on the quit smoking side, we've got a range of tools that you may wish to signpost to alongside obviously your local support. So the first is a free NHS quit smoking app. We have a 28-day email program that people may wish to sign up for. We have our local stop smoking service lookup tool on the website, which is now issue free. You'll be pleased to know. I know we've had a few issues with some service details in there. That has been resolved. We have a personal quit plan, which is 3 simple questions, which then takes the smoker into a personalised offer. We've got some really new and useful content as well, if you've not seen it, around vaping. Particularly on vaping, using vaping as a quitting tool. So I would encourage you to have a look on the website at that. We've got a new Mythbuster around vaping on there. And the final thing is we have an active Facebook support group for quitting smoking as well, which has got over 37,000 members. If you go on to the next slide, please. And the next one. So just to give you a quick overview of the sort of toolkit and the campaign resources that we're providing this year. If we move on to that, that's the one. So these are all, like I said, these are all live and available for you to download for free now on the link. And I think the link has just been posted in the chat. You do need to register if you haven't with our Campaign Resource Centre. It's a free and painless system. And you'll actually, by registering, not only get to access the campaign resources, but also you can choose to receive updates and alerts when new content's added, which is really useful. So there's a campaign toolkit on there, which includes a range of information, and then basically a suite of assets that you can use across your own communication channels, whether it's social media, posters, graphics for digital screens and waiting areas, and email signatures. Because there's no paid for advertising, what we'll try to do with the creative this year, because given it's a partner-led approach and you've got the flexibility to tailor it as you wished for local need, was just to kind of take Stoptober back to basics. And really, it just promotes the fact that if you stop smoking for Stoptober, i.e. that 28-day period, you're 5 times more likely to quit for good. So if we move on to the next slide, you'll just see some of the visuals. Again, try to use sort of photography in that sense of people like me. You'll see it's NHS and Better Health branded. Again, the one thing I would stress is that you're welcome to use these as they are. If you're signposting into the National Better Health website, for example. But if your communication team has Adobe InDesign software, we've made within the download files, we've included open artwork that you can use within there. If you want to, for example, switch out search Stoptober, you may wish to put a local website or a phone number or wherever it may be within there. Equally, change some logos. So you're welcome to edit those as you see fit for local need. Alongside that, on the next slide, just some examples of some of the social assets that we've got. So what we've tried to do is provide a kind of generic, overarching suite of assets, just promoting Stoptober, the fact it's coming. There's a couple of assets on there sort of to use on the day of 1st of October, say Stoptober's here as well. And then alongside that, the other 3 animations on that slide. We've got one that promotes sort of different types of quitting support, quitting tips, and also the health benefits of quitting as well. So they've just played through quite nicely there. They're all free to download on the CRC now.
Next Alex, slide, please. I'm just ask you to hurry up a bit.
Yeah, okay? I've nearly finished.
Thanks.
So that's just an overview of the toolkit itself. If we move on to the next slide, you can download that and look through. Just to mention, if you wanted print materials, we've got a range of always-on materials, including the wallet card, easy read, and various posters as well. And there's a new video promoting the NHS Quit Smoking app as well. Next slide, and the next one. So final slide from me. As I said, everything is live now. We recommend starting it as soon as you possibly can in the run up to 1st of October, and then using case studies and things to sort of keep that momentum going throughout the month. I have got one final slide if you could move on to that one, please. So again, evaluation, anything that you can, I mean, again, in previous Stoptober campaigns, you've been really great at providing feedback. One about the resources themselves, and have they been what you needed? Was things that you could have done with that we can consider for future campaigns? So anything you can do to provide sort of examples of local activity. If you're promoting local services, for example, it'd be great if you could provide any evidence or data that shows, you've maybe seen an uptick in people accessing that from your promotional activity. I will be sending around an evaluation survey towards the end of October as well, which will just be a simple thing to get your feedback about the assets and what you've done. And equally, finally, if you want to promote the national resources and signpost people into the National Better Health website to help you track that, we can provide unique trackable links. So please just get in touch if any of that is of interest to you. So I'm to time, so I'll hand back to Hazel, and thank you very much.
Thanks, Alex, and cheers for speeding up a little at the end there.
That's okay.
Please do hold on because we've definitely got some questions coming through in the chat, so people keep adding those. Right, I think we're over now to Katie Connolly from Humber and North Yorkshire Centre for Tobacco Excellence. So, Katie, do tell us more about maximising Stoptober.
Yes, good afternoon, everybody. So we'll move over to the next slide, please. Today I'm going to talk about how we can leverage free and low-cost marketing channels. So we're going to go through funding challenges and then collaboration, coordination, innovation, and amplification, which are the four kind of priorities that we work towards. So funding challenges, I'm sure you can all relate to this one. We're currently in a situation, so the Humber and North Yorkshire Centre for Excellence in Tobacco Control is funded by the Humber and North Yorkshire Integrated Care Board, and we have a spending freeze at the moment following the general election. So where we had these nice budgets and we were hoping to be able to do lots of lovely marketing activity, we can't plan in any of the paid for. However, in times of challenge, that's when we get the greatest creativity. So I think it's a great opportunity to focus on what we have and what we can do with that. So I think the great thing is, as Alex mentioned, Stoptober is an existing calendar moment. It's been going for 12 years. Everybody knows what it is and when it happens. So we're already off the starting box with that. We've got a great toolkit full of resources and graphics that Alex's team provided. We all have fantastic networks available to us with varying different channels. Inside that as well, there's a dedicated and passionate and expert workforce from locally commissioned services, public health teams to hospital tobacco dependency treatment teams. So there is a wealth of experience and champions there. Everybody has plenty of success stories and sort of local champions that are more than happy to come forward and be spokespeople. There's a wealth of reliable data and evidence from the various sort of brilliant resources that Ash have, the Ready Reckoner, and then you've got this sort of fingertips data as well. There's loads of things that we can use to get our messaging across as to why this is so important. And as Hazel mentioned at the start as well, you can't look anywhere without the media attention on the tobacco and vapes bill. So it's a really great opportunity to ride that wave and jump on there. There's never been a better time to stop smoking because it's on its way out. So moving on to the next slide, please. So we started off with a kind of collaboration approach. So met together with all of our system partners across our integrated care board area. So discussed all the different channels available to us. So your kind of local authority public health teams have got brilliant networks with leisure centres, libraries, children's centres, community hubs, schools, colleges. Then you've got universities, shopping centres, business and workplace networks. And then primary care trusts, pharmacy networks within the ICB. We've also got dentistry and the Cancer Alliance and the hospital trust. So, I mean, that's just scratching the surface on the different channels that we can use. In addition to that, sorry, go back to the first slide. So got targeted text messaging. Some of our place areas have got systems set up. Some are just exploring systems at the moment with social housing. Messaging out to everybody that lives in social housing, and they're also offering swap to stock kits to residents. Then you've got kind of workplace groups. So one of our hospital trusts has a WhatsApp group set up for all the staff. So they're going to send a message out just encouraging people to look at the NHS app or go to their local commission service. Obviously, e-newsletters, most of the different channels have e-newsletters, primary care networks and trust staff newsletters. Slide, please. And then I think most locally commissioned services have outreach events organised already, or they're planning them. So it's just kind of pulling those events together and making sure that everybody's aware of them so we can promote them in the best way. Some are looking at shopping centres, surgeries, leisure centres, libraries, and education events in school. There's obviously print and digital if you have that available to you, although, as mentioned, many people will not have budgets for that. But there are various digital ways that you can get the message across that generally don't cost anything. For example, on your own websites, web teams might be able to just add a banner at the top. Social media obviously is a huge one. We've all got loads of case studies. Could record advisor top tip videos. We've done some myth busting videos that we can share out across our channels. And another key point in that, I think, is internal communications and education. Some of our locally commissioned services hold a range of kind of virtual training sessions on an ongoing basis. We also get a lot of clinicians approaching us asking for up-to-date information on vaping, and there are some brilliant resources on the NCSCT website. So again, it's maybe just circulating those out to your networks, making sure that everybody's confident to have those conversations. The NCSCT have got the 30-minute training session on there. Just circulate that across sort of primary care teams and hospital trusts, and if a few people take it up, brilliant. They're more aware. And I think it's making people aware, certainly in hospitals, of the tobacco dependency treatment services, an opportunity to remind people about that, and just remind everybody about the support that's available. So next slide, please. So how can we add value and reach further? As mentioned, obviously it's time of financial strain, but there's a lot of creativity around there. So something I'm doing is kind of looking at all the angles on how we can really make that message relevant to the audience and make it land. So kind of looking at the newsletter copy that's been provided, we're adapting versions of that for different audiences rather than repeating same message that may not sort of resonate with people. So, what we need to tell parents might be slightly different to what we need to tell clinicians. So just making sure that we've tweaked and made it fit the audience. Also, you've got some people that are going to be driven by health messaging and some that are going to be driven about wealth. So, actually, October's a brilliant time to quit because how much will you have saved before Christmas? And, is this the best Christmas present you can give to your family? So a few examples of other activity that's taking place across our ICB. One of our place series is going to do a roadshow around libraries, which you may think nice libraries in lovely little villages, but there's always libraries in key areas of deprivation, and they really are community hubs where everybody's welcome and nobody has to pay. So you find a lot of them will do free sessions for parents and kind of job seekers support using the computers there. So actually it's a really great location when you want to access people that might really benefit from the support. So yeah, they're doing a library tour around the whole network. As mentioned, we've got some areas that are doing text messages out to their social housing, others that are doing that are training up their housing officers to be VBA trained so that they can talk to people about their smoking and understand where they can refer people onto. We've got some of our tobacco dependency teams have linked up with public health teams and locally commissioned services to do outreach events in hospital foyers, along with the oral health teams as well. And then personally, I'm doing 6 staff roadshows across our integrated care board and attending the Cancer Alliance AGM with 2 hats on, really, kind of about the tobacco and vapes bill and Stoptober. So yeah, I think the main thing is for people to find different champions that can share the message. The more voices we have sharing the same message, the better, whether that's clinicians, people that have quit, tobacco dependency advisors, locally commissioned services. There's always different voices that can give a different angle on that. Next slide, please. Yeah, and I think it's working smarter and not harder. We're all in it for the same goal. We want to encourage people to stop. Can we share each other's resources? Can we share any other case studies that you find online? And making sure that PR opportunities are linked up as well, so we're really making the most of it. And the other thing to mention, as Hazel said, the tobacco vapes bill. We're also, across the ICB, planning a bit of activity to garner kind of support in the area for that, which is a brilliant opportunity to link up with Stoptober messaging, because the activity is planned to take place in October. So where we've got kind of PR stunts and outreach events, we can work in partnership with locally commissioned services and public health teams to align with Stoptober messaging. So you're really getting that harm and hope message at the same time. And that's everything from me. Thank you very much.
Thanks so much, Katie. We will go straight on, and hopefully we will end up with enough time for some questions at the end. So I'll hand over to Tracy, who's the Programme Director at the London Tobacco Alliance. Over to you, Tracy. Oh, Tracy, you may have to unmute yourself. I don't know. There we go.
Yes. I thought someone was controlling me, but I'm in control, so that's good.
Yeah, we're controlling the slides, but not you.
Anyway, thank you for inviting me, and it's going to be really interesting to see how we've all got kind of different approaches of really using the Stoptober brand, which is very, very strong, and trying to think about how we can amplify, but also kind of piggyback along with that. And so our approach is definitely an amplification of the existing resources, but we have also produced some of our own, really in response to our board who said they wanted something that felt very London focused. So if we go on to the next slide, please. Something's weird's happened with the colour, that's all right. But we have got a campaign for Stoptober, which is one of our straplines anyway, which is everyone's journey to giving up is different. And it's really using stories from different people, from different Londoners, and again, a hope, not harm message. And if we go on to the next slide, I hope that we'll be able to so that's our landing page. So we've got a landing page for some of our resources. And then if we could go to the next slide, that's going to be our film, which I hope will work. And the audio comes on about slide 3 or 4.
Whenever I got upset, the first thing I would do was reach for a cigarette. I went to the smoking clinic. The young lady there, Christina, was ever so helpful.
I realised that my breathing wasn't as it used to be. When I didn't really decide to give up smoking, because my breathing was getting more worse, and they said it's the cigarette doing it.
Well, it felt like the stub of a rolled cigarette behind my ear virtually all the time. You did get some little quick wins, but the longer term wins as well, like you had more money in your pocket, you felt better, you didn't get out of breath, and you didn't get those horrid sore throats. To anybody who's looking to stop smoking, don't stop trying to give up. You can and you will do it in the end. Believe yourself.
I've been advised to anyone who wants to give up smoking or stop smoking, all you can do is try.
I actually feel very good. I can walk, I go through Brockwell Park, I can smell the flowers. I really feel, since I've stopped smoking, that I have a better life. And I'll celebrate my 80th birthday without a cigarette. How about that?
Thank you. And I've seen some of the very positive comments. Really appreciate that. The video itself, just to be aware, it is good quality. It's just something's happened in the translation. Oh, and there's a ton of our other videos as well on my YouTube page. But if we go on to the next slide, please. So that's our film. So we've got social posts. So we wanted an asset, a new asset to launch for Stoptober. So we've got a hints and tips document, which I'll show you in a moment. But really, they're based on the 4 Ds of delay, distract, deep breathing, and drink water. And we've got some social posts that we've disseminated to our London local authorities and to other partners across London. And then if we go on to the next page, you'll see our hints and tips document. And this is a downloadable, there's a 1-pager, and then there's a downloadable guide as well. And we wanted things that people could view online, but also could download and actually have a hard copy, because some people like to do that. And if we go on to the next slide, please, you'll see, it's the next one along. you'll see this is our partner comms toolkit. So we've got posts that people can use, building really on what Katie says. There's a lot of stuff that you can do that's free. So here we've got posts that our partners can use, and we've got lots of downloadable elements in this partner comms toolkit as well. Next slide, please. We are doing work at the moment, which we hope will be finished, some of it for Stoptober, with the Polish and Romanian communities. And we've got a film of a Polish doctor who's talking about smoking. And we've got film of her speaking in both English and Polish. And we're going to translate the hints and tips guide into Polish, because we know we have high levels of smoking amongst our Eastern European populations. Next slide, please. And just, we are, I laugh, we were hoping to launch our digital offer for Stoptober. We've been going through painful procurement processes with the new provider selection regime, but we are hoping that we will be able to launch that at some stage in late October, and we have got an evaluation partner there as well. Next slide, please. That's to hand over to Fresh. Thank you.
Thanks, Tracy. Admirably succinct as well, getting us back on time, so that's good.
There you go.
And I think the great, obviously the video, really, people really loving it there, really high spec, and we're going to see a bit more of that from Fresh as well. But of course, with the, you know, much lower tech things can be done locally as well. And I think, you know, if you've got case studies out there and you've got people who can tell a really good story, you know, try and get a little video of them and see what you can do with it locally. Okay, Andy, I'll hand over to you, and then we should have enough time for some questions in about 10 minutes time. So Andy Lloyd, I feel, needs almost no introduction, from Fresh in the Northeast. Over you go. Over to you, Andy.
Thanks so much, Hazel, and some just tremendous examples there, really inspiring. So my session today, I'm going to be talking about our Smoking Survivors campaign, which has been an ongoing initiative we've been running since 2023, and relaunching again in the run-up to Stoptober and during Stoptober. But as per the title, it's more about the role I think real people can play in campaigns and how we can work with them, which is something we can absolutely all do. Next slide, please. So just really, if you don't know about Fresh, because not everybody's aware of who we are, short who we are for us. We were the UK's first regional comprehensive tobacco control programme, set up to reduce smoking rates at population level. We've seen the biggest decline nationally. Smoking is more than half, but as we all still know, tobacco still kills 2 in 3 users. It's our biggest cause of cancer. So we do work at that population level, raising awareness of the risks, keeping motivation to quit high, and really trying to sort of change the way individuals and communities think about tobacco as a social norm. I think it's fair to say since our launch in 2005, media campaigns really have been a cornerstone, and it's by working over a bigger area we can make campaigns go much wider and further by pooling those budgets. So currently these are funded through a collaboration through our 12 supporting local authorities in our region, North East and North Cumbria ICB. So massive credit to those partners as well as part of that wider commitment to reduce smoking. Important to also say we're a joint programme, including Balance, the regional alcohol programme as well. Next slide, please. So I didn't want to go through this in too much detail. I've done it in previous presentations, but I still think it's important to say that mass media campaigns running nationally, regionally, locally have a really strong evidence base, both in terms of their academic study, measuring the impact on populations around the world, not just the UK, but also by programmes who run these as well. Good evidence that they influence quitting rates, quit success rate as well, people keeping going as a result, and also some evidence around young people. Harm and hope has been mentioned sort of previously, and harms are particularly well evidenced for some of the reasons I'll come on to. They carry something which we call cut through, that people notice them. And I think it's fair to say that, many of us who are a bit longer in the tooth will remember that British Heart Foundation's fatty cigarette campaign. That's still an advert that a lot of people still talk about today. We know that TV also carries a lot of credibility and believability, though obviously, it's harder to afford, especially working locally. Catch-up TV, paid for social media, the likes of Instagram, outdoor channels as well, becoming more important just to sort of spread the net wider so as many people see our campaigns as they can. But it's not just about advertising, it's about PR, social media, they create the noise as well, and they're obviously a lot cheaper to do. They create a deeper experience often as well, and you can do this all year around. Next slide, please. I love this slide from Robert West, and I always use it. I always trot it out and completely ape this slide. But campaigns are a trigger. There's a lot of research around the evidence base and insight that go into creating campaigns, but they also do something really simple as well. And Alex mentioned in his slides, that counter effect of a clinician not mentioning smoking and that kind of takeaway message. And it's kind of similar to campaigns, actually, and noise around smoking. Similarly, people sort of say, well, if it was that harmful, it would always be in the news, it would always be on the television, it would always be on the radio as well. So, campaigns, noise, PR, they act as a trigger and a reminder, just like, I guess, the word of a doctor or a child sort of telling their parent that they worry. Next slide, please. Harm and hope. I'm not going to go into this too much, but I think it's fair to say the latest national insight suggests that people ideally need to hear both. And sometimes they're at different points to the journey in terms of which will have the most impact. So the reasons to quit, very important, but also the how to quit, moving people towards more evidence-based ways that increase their chances. So when it comes to harm, just to unpick that a little bit, people, everybody knows smoking is bad for them, but the scale of harm is not widely understood. So, therefore, that real shock at statistics like, 1 in 2 smokers will die early, which is now 2 in 3, or 16 cancers related to smoking, which really do something around reframing the understanding and the perception of harm. We know from some of the latest insight that the thought of living with a smoking-related disease is in many ways more scary than and something that people would want to avoid than just the notion of dropping down dead. But we also know that people can kind of spot a campaign that doesn't look real, and we need to be encouraging people to quit through ways they can identify with some great examples from Tracy there. So this is really where real people come in. People who've seen the harm of smoking, or can testify the benefits of quitting, or can testify to the benefits of why going to a service was really worth their time. Moving on to hope, it's about providing a sense that it can be done, that it's tangible, that it is worth the effort, that people like them can have done it and can do it as well, while also trying to steer people towards methods that give them a better chance. Just a couple of things that we've learned along the way as well through insight. We know there's a lot of confusion about terms like local support in terms of people's understanding of it, what it means, how it will help. So important that we stress around talking about friendly, free local support, non-judgmental local support, and how it can help. We also know that people do beat themselves up if they don't succeed, and they're pessimistic about trying again. So it's a little bit, I think, about reframing failing, the notion of not succeeding first time, almost as a stepping stone, as a part of the process. Next slide, please. So just moving on to real people, so campaigns featuring real people, former smokers, have got really long history in tobacco control for good reason. And there's some examples here you might recognize. The long-running campaign Tips from Former Smokers from the United States, the 1 in 2 campaign from HSE Ireland, featuring lung cancer patient Jerry, who very sadly died not long after filming it, and the really powerful Anthony Hicks film from Department of Health as well. Next slide, please. So our Smoking Survivors campaign has really tried to build on that approach, actually, an approach we've already used really heavily for our PR and our news media work, really cost effectively. But putting these people onto, these real stories on TV, putting them onto billboards, putting them onto radio, into leaflets, flyers, screens for public buildings. So very much in the words of people who've smoked, regretted it and quit, the impact on their health, their finances, their lives, and their family. But in other cases as well, a really empowering message about taking back control of life. So we've ran nearly 6 phases of the campaign since June. We're about to launch our next phase next Monday in time for Stoptober, which links to our quitting platform Fresh Quit, which features advice and local stop smoking services, really trying to sort of provide the hope when people click through and arrive, make a fresh quit, because next time it can be different. Next slide, please. So our next phase features 2 new case studies on top of the original smoking survivors, Sue and Kathy. So Tony, who developed laryngeal cancer at 52, and Denham, a wonderful man who supported our work in the early parts of 2010, 2015, who very sadly died of COPD in 2021. And his widow, Debbie, and daughter, Sadie, have worked with us to make a film about losing a loved one and not being there to see the big moments in life, like walking your daughter down the aisle, or being there to see the birth of a grandchild. Next slide, please. And I just wanted to show you also how we're kind of localizing some of the resources to support partners, and especially around promotion of local stop smoking services, really trying to tie in with the Stoptober moment. So just some of those resources there that we're producing for things like posters, socials, screens, waiting rooms and buildings. If we've got time, could I ask Jim now? Jim, could you play?
We've got time, as long as you're super speedy on the final slides.
Yeah. I'll go on ×2.
Just watching somebody there gasping for breath. It's not very nice to watch, and you feel so helpless because you can't help them. In his prime, he was a fitness instructor. He always smoked. When he was in his 30s, he was starting to struggle to breathe, and he started to find he couldn't do the things he loved. I've never knew my dad to be fit and well. I can only remember him being on oxygen and in a wheelchair. But obviously we've seen a lot of dark times, saying our prayers at home, hoping that he'd survive this hospital trip. Now looking back on that night, I think he was asking for my permission to let himself go. He used to say, "Oh God, if I could only have my time back, I would never have smoked." Stop smoking now. Do it for your family, not just for you.
Put smoking behind you. Get help to quit at freshquit.co.uk.
So obviously a huge tribute there to the Thomas family there from Hartlepool. But again, I think a lesson that real people constantly amaze you with the real passion they have to try and help others and try and stop other people going through what they've gone through. Next slide, please. I won't go through the evaluation slide in any detail, but it's just to show that we do an independent survey at post campaigns. Evidence that it was successful in triggering quits, cutting down, switching, also being mentioned by local quitters in services. And people did talk about the power of seeing real people featured. But importantly, that it was really interesting. They really crossed borders and boundaries, so people empathise even if stories weren't completely local to them. And Sue's advert, in fact, was featured by Department of Health in May when we worked with Alex to bring that around the country. And she was actually stopped when she was in Harrods in London in March by a gentleman who'd seen the ad and said his dad quit as a result. So really inspiring. Next slide. I'm nearly there, Hazel. Don't worry. So I guess lessons learned, there's so many, but, there are so many compelling real stories out there, using the stop smoking services, NHS networks, clinical networks, even Facebook, people will share their stories, both the harm of smoking, but also the hope of quitting. Katie mentioned this, no one campaign's a magic wand that works with everybody. So that's why we rotate them and try and focus on different themes. There's opportunities to promote real people throughout the year. So we've sort of updated the resources for No Smoking Day, for New Year, for Stoptober, and these are TV ads. But you can do this really cost effectively with an iPhone, and just somebody wants to share their story about quitting or the local stop smoking services. Even just a 50 quid boost on Facebook can make it get seen and heard far more widely. And obviously, as we've said, there's loads of opportunities to engage with news media as well. I think the other thing just to mention in terms of advocacy and people will really surprise you how much of a stand they'll take, not just about encouraging other people to quit, but the role that they take on as quitting ambassadors. So for the likes of Sue and Kathy, who were our original smoking survivors, they became real champions for the new smoke-free generation, laws going through Parliament. They spoke at the APPG, all-party parliamentary group, back in March in front of the minister, and really became advocates, working with Cancer Research UK for more measures to cut smoking. On the last slide. So I'm really conscious I've slightly glossed over the theme of the webinar about supporting Stoptober, but just wanted to show we've really supported the campaign. Since it launched in 2012, we run an annual roving photo call with partners. which we put out and share with partners for PR and social, local support, NHS, local authority partners coming together, bringing quitters, and again, just that trigger and the reminder that we're talking about. We've involved the local sports clubs, schools, local communities, even Newcastle United and Sunderland, and just at the bottom there, yes, that is England keeper Jordan Pickford in his younger days holding up a Stoptober kit. So I'm going to close now and hope this has given you a few ideas.
Brilliant, thanks, Andy. Can I get all of our speakers back up? And I apologise that I am a black box. I don't know how to make my video come on, but my daughter told me this morning, she said, "Are you going to work dressed like that?" So maybe it's just as well that no one can see me. Okay, we've got some questions. I think so there's I was going to come to something else first, but there is a question here from Lee about, we've got the Stoptober resources and then also the regional resources. So Katie, Andy, Tracy, what would your answer be in terms of what resources people should use if you're in the North East, if you're in Humber, North Yorkshire, if you're in London, do you use a combination of resources? What's your advice to people locally?
That's what
Tracy, go on.
Sorry, yeah, that's what would be encouraging, Hazel, because the brand is Stoptober. It's really, really strong. People are used to seeing it, but there's a kind of adjunct too, and that adjunct using our kind of Stop Smoking London branding then takes us through the year as well. So I think, and it may be interesting to see if people find that that's confusing, but the fact is that we are using the message of Stoptober. So I think it would be, that's certainly what we encourage in London, be used to hear from others.
If I might just chip in there, Hazel, as well. I think the other key thing is just to recognise that not every part of the country has a dedicated tobacco control programme, like Fresh in the North East and Stop Smoking London, and obviously Katie up in Yorkshire and Humber and Greater Manchester do as well. But there are a lot of areas that don't have capacity or resource in that same way. So I would agree with Tracy. If you've got a local offer like London, use that. If you want to, there's no reason why you can't incorporate some of the national stuff if you wish to as well. But it's particularly those areas that don't have anything. We were really mindful that we want to at least give them something to use, so they didn't have to fund production of their own. So
brilliant. And then Alex, I wonder if I could just ask you to pick up some of those practical questions about what people can and can't download. People can get posters this year. What can they get?
There's no print. We haven't provided print for some time, unfortunately. That may change in the future, depending on budgets. I would hope so, at least on a basic level. I've responded to a few comments in the chat, but if you haven't got capacity to print locally, then obviously try and just make use of the digital resources instead, whether that's on digital screens or through your communication channels such as social media and websites. But there are printed posters and materials for what we call our always on Stop Smoking resources, but not specifically for Stoptober this year.
Thanks for clarifying that, Alex. Right, we've got some questions here, and it was a question that occurred to me as I was looking at all of those wonderful case studies that you've got in the North East and Tracy, you have in London. What advice we can offer to other people about identifying these people who are prepared to tell their stories and supporting and cultivating them. Andy, if I come to you first.
Yeah, I mean, there's a number of routes, and I think probably the most obvious ones are local stop smoking services, because people go through the services all the time, and I think when people make it to that 12-week quit period, they do tend to like to sort of sing from the rooftops about how great the service was and how much better they feel. I think there's a little bit of something around giving something back as well. Maybe for more harder hitting stories, tobacco dependency treatment services in trusts are a really good place to look. But we've got case studies through a variety of sources. I mean, generally they come through the system, but very often we'll get people getting in touch as a result of seeing campaigns. And one of the things we see a lot on social media is people will story share. You put something out there, and it's quite staggering sometimes how people will share their story about losing someone or having COPD or quitting and feeling great. And, that's a really good place to get the conversation going. And just sometimes it just takes that point where you sort of say, look, you wonder whether you'd like to share your story to encourage others. And not everybody, it's not for everybody, but very often people will want to do it. So it's kind of always been on the lookout.
Thanks, Andy. Tracy, Katie, is there anything you would add?
Well, it is hard, Hazel. you have to follow up a lot of leads. So it is not an easy thing to do. And it's kind of like buses. And we got 3 that came along at once. We've just got another 3 that have come at once, but that was after a barren period. So I'd say you have to keep trying. We've got some through our respiratory network, through our clinical lead for the respiratory network. We've got others through Stop Smoking services. So it's variable, but it's hard. So don't be disheartened. Actually,
keep on keeping on. And Katie, you've had some really great people who, certainly that we've been working with nationally. Is there anything you would add?
Yeah, very much what Tracy said as well, in terms of just keep on asking people. We speak to our preventive treatment teams. We had some brilliant sort of staff in hospitals as well, just kind of building those relationships and people, and just getting out there and talking to people. And a lot of the time as well, they say, "Oh, I'm not interested," but actually you have a bit of a chat to them and then they say, "Oh, do you know what? I might do a video," or and you just got to keep your resolve and keep chatting to people really, and just make it known to all your partners as well. Constant reminder. I mean, I kind of do an email every month and just say, anybody that you could possibly ask, can you just do another shout out? And somebody always seems to come forward again then.
Fantastic. Well, I think probably I could ask you another question, but I might be at risk of taking us over the time. So that might be a good note on which to end it. So I think that the summary really from today is there are lots of resources nationally. If you're lucky enough to be in the Northeast, in Yorkshire and in London, there are additional resources for you. And I know Greater Manchester also have some tools as well out there. It's a real opportunity, I think, in the coming months to look at some of that earned media. Like, what can you do locally? How can you tell a story that will resonate with your local politicians, with your local media? How can you find people who will tell their stories and tell it powerfully, be it on social media or in that mainstream media, and get the message out there about Stoptober? So great to hear from everybody today. Just some absolutely brilliant videos, brilliant assets nationally as well. And look forward to hearing how it goes out there locally. Definitely, tweet us, copy Ash in, send us emails and tell us, what you're doing, and we will try and amplify that as well. So thank you so much to all the speakers. Thank you to everybody who came along today. And if you have any questions that we haven't answered, then do drop us a line. Cheers, everyone.